So when can midlines be inserted? After the midline has been ordered, the proceduralist will be reviewing your medical and surgical history, documentation of chronic kidney disease, recent chest trauma, dialysis, shoulder surgery, sepsis, arm infections, or recent pacemaker placement will require further investigation or clarification before insertion. Additionally, the indication will need to be valid before the proceduralist proceeds. If they find an issue, they may not perform the procedure at all. So what are the contraindications for placement? Here's a list of reasons why we may not place a midline. There's a patient history of thrombosis, hypercoagulability, decreased venous flow to the extremities, or end-stage renal disease requiring vein preservation in accordance with INS standards of practice. For renal or dialysis patients, an order must be obtained from a nephrologist to use this product. TPN, or total parenteral nutrition, through a midline is contraindicated. To infuse more than one vasopressor through a midline is contraindicated. To infuse a single vasopressor without the ability to draw blood through the midline with a 3 ml syringe is contraindicated. Placing a midline on the same side as a mastectomy, arm injury, or arm infection is contraindicated. If the patient's body size is insufficient to accommodate the size of the implanted device, a midline is contraindicated. If the patient is known or suspected to be allergic to materials contained in the device, the midline is contraindicated. Local tissue factors and/or past treatment that will prevent proper device stabilization and/or access are contraindicated. Examples might include recent shoulder surgery or recent pacemaker placement. Thank you for watching. If you enjoyed this content, consider liking the video. Leave us feedback in the form of a comment if you have any questions, concerns, complaints, or compliments. If you want to see more content like this, consider subscribing to see more footage like this. Till next time, stay safe.